Good evening and welcome to the League of Women Voters Presents. I'm Jim Robertson and our topic tonight is the high and rising price of prescription drugs and what it means for consumers and for businesses. My guest tonight is Jan Swaney, Dr. Jan Swaney, a local physician. And Jan, tell us, I know you're interested in this topic and have been advocating on this issue for some time. Tell us about your practice, about yourself, and how your advocacy evolved in this.
Okay, great. Well, it's an honor to be here. I moved to Columbia in 1986 and joined the faculty at the University of Missouri's Medical School in the Department of Internal Medicine, and have practiced in Columbia for about 25 years since then. I started at the VA as a VA-based physician caring for veterans in what is a very top-down sort of healthcare system. And then after a number of years, moved to the University of Missouri's hospital and clinics and worked at Fairview Clinic as a primary care physician there for years. And then at a point in my career, mid-career, got a master's in public health and became medical director for a Medicaid healthcare plan here in the state of Missouri, one called Missouri Care, which at the time was owned by the University of Missouri. And we delivered care to 35,000 Medicaid recipients in central Missouri, all of whom were primarily rural, Medicaid eligible moms, babies, and adults. And I learned a lot about how health insurance works from the inside, having had that position after 15 or 20 years as a practicing physician. While I had that job, I continued at the university as a volunteer faculty member supervising students and residents in outpatient internal medicine clinics. And so it's that breadth of experience that leads me to realize how dysfunctional our system is. And at this point in my career, I would say as a retired physician now, I have the time and the discretion to be able to spend it on issues that really matter to me. And I feel like healthcare consumers are getting a raw deal out of the healthcare system and out of this price gouging on prescription drugs in particular. I watch what happens in Washington. I have the long view. I've seen how prescription drug manufacturers have gradually gained influence within medicine, within Washington, and it's deeply disturbing to me. So I'm trying to work constructively with others to find some solutions that will help the citizens.
That's right. Well, healthcare, we often hear about the cost of healthcare to our society, our country, our economy. It's what, 15 or 17% of economic output.
Yes,
is
GDP.
Tied up in healthcare.
Yeah, over 17% of GDP now, about a sixth of our economy.
And prescription drugs are a significant part of that.
Yeah, prescription drugs are about 10% of our healthcare spend right now, but they are the single fastest rising portion of healthcare spend. They're rising at rates much faster than overall inflation and even faster than healthcare inflation, which usually outpaces inflation. They've risen about 15% per year, year over year, in the past year or two. Much of that from some fantastically inflated launch prices for new drugs that are coming on the market. But we're also seeing headlines about older existing drugs that are being, there's price gouging going on older existing drugs too. So there's a lot to talk about.
Yep, and I know that you brought a series of slides that kind of will guide our discussion here.
Yeah.
So I will get out of your way for a minute here and let you introduce the first topic here.
Well, I think I'd like to just make the point at the outset that it doesn't have to be this way. We're the only country in the developed world that spends like this on prescription drugs. We spend 2 to 3 times what other developed countries do on prescription drugs. And it mainly comes down to price. You might ask, well, maybe we're on more drugs. Yes, we're on slightly more drugs per capita than other countries, but much of the problem lies with pricing. And there are several reasons for that, but for the most part, it's because brand name manufacturers are granted by our government patents and exclusive licenses to market that particular drug for several decades without any competition. And once a drug manufacturer is granted a patent, they often get follow-along patents on that same drug because they may decide to try to patent the delivery system or a manufacturing process that's never been patented. There are some drugs out there that have up to 100 patents on them, Humira, for example. So it's going to be a monopoly for decades and decades to come. So the government has intervened and allowed manufacturers this monopoly pricing situation, but it hasn't at the same time done anything to guarantee that consumers are protected from price gouging while these drugs are given a monopoly status by our government.
Why does the pharmaceuticals industry have such enormous power?
Well, they're very profitable industry, in part because of this monopoly pricing, and they have invested heavily in lobbying our members of Congress. They are probably one of the most well-funded lobbying sectors in Washington, D.C. There are 2 lobbyists for every elected official in Washington. They fund elections, they get out in the states and they lobby in state legislatures. They have the money, and our legislators listen because of their clout.
Mm-hmm. They can, obviously they can't give away the money, but they can back a candidate with their money.
Yeah, absolutely.
And really affect elections.
Yes,
That's their
absolutely.
power, I guess.
Yes.
I have we're kind of wandering around here, but I have a friend who is in the pharmaceutical lobbying, and his argument is that it's the R&D basically argument, and it's not that it costs so much to introduce one drug, but that they may have a dozen drugs that never make it to market, don't fail, or they fail, and so they have to compensate for the costs of those.
Right.
But as you point out, they still pay more in marketing than they do.
Yes. Well, I want to make it clear that as a practicing physician, one of the joys of practicing is having an opportunity to help people. And it's through drug treatment that we can treat some of these chronic conditions that can be so vexing. And so I am all for having a working formulary available that's effective. But I think in a counter argument to the sort of fear-mongering that pharmaceutical manufacturers disseminate, like, well, if you try to control our prices, our pipeline will dry up, we won't have any new drugs to bring to market. They are the single most profitable sector in the U.S. economy, with profit margins approaching 30%. And no other sector of the economy has that kind of profit margin. That alone would suggest there may be some room to maneuver to bring consumer protections to play. And it's also true, as you said, that the manufacturers spend twice their research and development costs on marketing. All those glitzy television ads, all the things they do to reach out to physician practices and influence their prescribing habits. They spend twice on marketing what they do research and development.
Well, I don't know where we are on the slides here, but Sean, our first one was the U.S. spends twice the developed world on prescription drugs. We've talked about the next one, the strength of the pharmaceutical industry related to other industrial sectors in the United States.
One interesting thing about their research and development costs that I've learned, most of the source of information that usually gets quoted is a study coming out of Tufts University, an institute that's funded by the pharmaceutical manufacturers, housed at Tufts University, published a few years ago a study saying that it takes about $2 billion to bring a drug to market. But it turns out that that institute is funded by the pharmaceutical manufacturers, and even though it got published in peer-reviewed literature, they did not disclose any of the companies that they studied or make available the sources of information that they were provided. So it's a black box. And if you look at SEC filings, there are many who refute that number and would put it more at 400 to 500 million would be the median price to bring a drug to market based just on research and development, not the marketing costs.
400 or 500 million sounds like a lot of money.
Yeah.
What can they expect to profit on?
Well,
that kind of drug,
they can expect 20 to 40 years of a monopoly.
Yeah, that's some big bucks.
And generally they do quite well with that.
Yeah.
And, the evidence is coming in that they're profitable.
Yeah.
Yeah.
About 1 in 4 have a difficult time affording their medicine.
That's true. That's some Kaiser Family Foundation data, and they do track that among Americans. If you look at people who have chronic illnesses like diabetes, high blood pressure, hepatitis, that number is much higher because those people are on multiple drugs on an ongoing basis, month to month. So the Kaiser poll shows that when people have trouble paying for their drugs, this ultimately becomes a drag on the economy because in lieu of because when they want to try to buy their drugs, they are not purchasing other things for their household. They're deferring the purchase of a new car. They're not taking that vacation. They're not going back to get that second degree. They're taking a second job, borrowing money from family and friends. So there's a ripple effect throughout the economy when people can't afford or have trouble purchasing their medications.
Are those, I guess that cuts across demographics. You couldn't say that the elderly are more likely to not be able to afford drugs, or is it the young? I mean, is there any research on that?
I would say it's kind of complicated because now high deductible health plans have become the norm amongst a lot of employed people, and so people are on the bubble for prescription drug costs even when they have insurance. So there are a lot of people who are underinsured, either because of a high deductible plan or because they are uninsured, and then there are people who have Medicare who are on a fixed income and may not have a Medicare Part D plan, and they have no cap on their prescription drug costs. So if you're elderly, you're on a fixed income, you have a lot of medical problems, a lot of pharmacy costs, there's no cap on those costs to you. So it really cuts across demographics by age and by socioeconomic group. But by and large, people who are wealthy or well off can afford the out-of-pocket costs better than can others.
Another canard, maybe,
Uh-huh.
is that if you can't afford the drug, that the drug companies will help you.
Well, yeah, I'm glad you brought that up, Jim.
Canard is a good description.
That's perfect. Thank you so much. So that is a commonly used device now to prop up exorbitant drug prices. And what the companies will do is they'll set this outlandishly high price, knowing that most of it will be required to be paid for by the insurer, the payer, whether it's Medicare Part D or an insurance company. And they know that the consumer will be out for a bit of that through their copays and deductibles. And so to prop up that really high price that will be paid for by taxpayers and employers, they then will give a coupon to the consumer to help them pay for their copay and deductible. So it enables the consumer to get their drug without having such high out-of-pocket costs, while all the while driving up costs for us all, because it enables a system of exorbitant pricing that we then pay for as taxpayers when we fund Medicare, Medicaid, or as purchasers of our own health insurance, because my premium rates are going to go up this year because last year pharmaceutical manufacturers jacked up their prices, and I get to pay in my premiums this year.
Right. That's the way it works.
Does that make sense? Thanks for bringing that up.
Well, okay, the next slide is the rising cost of prescription drugs, or spending on prescription drugs.
Right.
Why is the cost rising?
Well,
I mean, they're making obscene profits.
okay, I have some good news here. Generic drugs are falling in price. So I do want to cut some slack to the generic manufacturers, right? They are 80% of the drugs, more than 80% of the prescriptions written and filled, and they're like 10 to 12% of cost. So thank you, generic manufacturers. Everybody else is a brand name manufacturer, and by and large, they operate, as I said earlier, in a monopoly type of situation, so they can price their drugs at what the market will bear. There are no constraints on their pricing, and because of some legislation that we might get to on Medicare Part D, they know that whatever they price it at, the government has to buy it.
Right. So hence
That's a good segue.
constantly rising.
Yeah.
Yeah.
So I think it's worthwhile to spend a little bit talking about Medicare Part D,
Yeah.
because even when I was practicing, I was kind of glad to hear that seniors were going to have some help paying for their prescription drugs, and I thought this was good. Turns out that this legislation came to the floor and was voted on in one day. I can believe that. In 2003. 2003. It all came to the floor and was voted on within one day.
Wow.
One of the clauses that got slipped in, perhaps unbeknownst to our legislators, I'm not sure about that, was that Medicare had to buy prescription drugs for its beneficiaries. But, oh, by the way, they couldn't negotiate prices with the drug companies. They had to pay whatever it was that the drug company asked for that drug. It's called the non-interference clause and has really fueled government spending on pharmaceuticals ever since Medicare Part D then was enacted in '06. It was passed in '03, enacted in '06. We've had it for about a decade, and we've seen drug costs just mushroom over that period of time.
Who does that? I mean, volume is supposed to reduce.
There are no pressures.
Costs.
There are no downward pressures on drug pricing.
Do you think that
in the
the
United States.
pharmaceutical industry might have been behind that?
What do you think?
I
I don't know.
don't know. So, okay, you have Medicare, Part D. What about other? What about Medicaid? What about the VA health system?
Yeah. So Medicare is the single biggest federal government program purchasing drugs right now. The VA and Medicaid are very different in that they are handled through different pieces of legislation, and they are mandated to negotiate prices with drug companies. So there's a little carve out there. The VA negotiates based on clinical efficacy and quality, as does Medicaid. But all in all, one point that I think is worth pondering is that the U.S. government pays for 66% of health care in this country. By the time you look at the VA, Medicare, Medicaid, health insurance for government workers, the Public Health Service, the Coast Guard, the military, the Indian Health Service, the CDC, all in all, government purchases 2/3 of the health care in our country, and we are missing out on the opportunity to leverage that purchasing power on behalf of our citizens to make drug prices affordable. We are, the U.S. government, we taxpayers, we are the Walmart, the Amazon of healthcare right now. But because of some legislation, our hands are tied, and we're not able to control prices.
We are rapidly running out of time, but there are a couple of things I want to touch on here. The EpiPen is a high-profile example of a drug that went along for years and years at a reasonable price,
Right.
And then all of a sudden it leaps.
Yeah, how about that?
Yeah. So what happens with that?
Well, I wish I could say that was rare. It did get a lot of headlines, but that is becoming more and more common. The people running drug manufacturing now are money managers. They're no longer people who have a public conscience. EpiPen was purchased by Mylan Pharmaceuticals in '07, and at that time a dual pack costs a little less than $100. They have ratcheted that price up and up and up about every 6 months, and so last year it went to over $600 for a twin pack, and it did so right before our parents were about to send their children back to school. And many of them will send that child with an EpiPen if they have
drug.
exactly, it's a life-saving drug. The EpiPen itself has been available on the market for decades, and it was never price gouged in the past. In fact, it was developed with U.S. government research. That's another point I'd like to make. The EpiPen injector, the auto injector, was developed by an engineer working for the Department of Defense who was trying to figure out how soldiers on the battlefield could inject themselves with an antidote to a nerve gas that they'd been exposed to. So he came up with the auto injector years ago. That licensed has been purchased and sold multiple times. Now it's in the hand of Mylan, and they haven't innovated. They have just price gouge. That's just it, pure and simple. They want to blame the middlemen in this black box, and we haven't had a chance to talk about that today. But it's a fantastically lucrative drug for them. They've taken it from about a $200 million market to a $1 billion market, partly because of some legislation passed in 2013, which required schools to stock an epinephrine auto-injector. EpiPen went out and provided a free one to all these schools, so all the parents want to buy what it is their school stocks.
Create a market.
Yeah.
And fill the,
Right.
well, it's, you know, there are so many directions we could go on this topic,
Right.
and unfortunately we don't have a lot of time tonight, and we've only hit some of the high points.
Right.
But I did ask you, and you have prepared a slide that gives people some resources if they want to get involved, if they feel interested in this issue, and everybody should be interested
Absolutely.
in this issue. So maybe you can talk a little bit about what people
sure,
can do.
I'm sure everyone has a family member who is struggling to pay for health care costs and pharmaceutical costs. So I would urge you all to contact your elected representatives in Washington and tell your story. Tell them why this matters to you and that you want something done. It's a complicated set of solutions, but if they hear from you and you keep the pressure on them, I think that that will help. I also have some recommendations that have been vetted by Consumer Reports, and so I want to pass those on to you. First of all, I'd encourage you to work, if at all possible, with your hometown pharmacy, because we need the small independent pharmacies in our pharmacy ecosystem, if at all possible. And if you're working with a hometown pharmacist, ask him or her whether this is the lowest price. There might be a little leeway on the price that you're offered at the pharmacy counter. I have to say, talk with your doctor, because there are times when, if you see multiple doctors, your medication profile expands, and it's important every now and then that efforts be made to contract it. So maybe there's a drug that was started a year or two ago that you no longer need. Something else took its place, and you know, or the condition got better. So talk with your doctor about reducing the number of medications you're on and switching you to generics that are available. I don't know how much time we have. You'll stop me? We're out of time.
We're reaching our limit.
All right.
But hopefully our viewers can see this excellent list of suggestions. Get the get the phone numbers for your representatives and let them know what you think. Jan Swaney, thank you very much for coming tonight. I wish we had more time.
Thank you.
Maybe we can do it again.
All right, that would be great.
And thank you for joining us. Until next time, good night.